In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking up too much of your time. Today, we're super honored to have our special guest, Dr. Farah Laurent, doctorally prepared nurse practitioner. We're going to be talking about one of her favorite topics, sepsis, the prevalence and incidence rates, risk factors and associated diseases, treatment, and all the people who will be on your team if you happen to get diagnosed with it, and ways you can prevent it. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, another doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. By watching on YouTube or listening on your favorite podcast app, we hope you feel empowered to ask questions, educated on how you can manage your health at home, and confident to navigate the healthcare system. If you haven't already, please subscribe so you can be notified when we release a new episode. Thumbs up the video, leave a comment or two. It helps the algorithms know that this information is important, and it'll make sure that people who need to hear it will get exposed to it. As a friendly reminder, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency or know someone who might be, you can call 988. Well, welcome, Dr. Florence. Did I say that? Welcome
Yeah,
to
Dr.
the
Vaughn, that's good. Thank you so much for having me. I'm so excited to be here and talk about sepsis and all things sepsis. So I appreciate you and thank you for all that you're doing for the community and for nurses.
Oh, thank you so much. Before we jump into sepsis, let's get to know you just a little bit. If you can tell us kind of just like your background and like as a kid and also your nursing background.
So basically, I immigrated to Canada when I was about 9 years old. First language was French. I immigrated from West Africa. And it was very interesting going to Canada. It was a bit of a culture shock as a kid. I always knew that I wanted to go into the medical field and nursing. I used to like play with my dolls and put band-aids all over them and like waste the band-aids. And I thought it was really cool, to be a nurse. And then in high school, I was like, well, I don't know, maybe I want to be a photographer or a dance choreographer. So that didn't work out. And I was like, well, I think I'm going to go into nursing. So that's what I ended up doing. As a kid, I was always very vocal, very empowered, very positive, happy person. In fact, my name, Farah, means happiness. And I'm very proud to be a first gen immigrant. I was the first to graduate from my family with a bachelor's program, bachelor's in nursing. Shortly after that, got my master's and just recently my DMP here in New Jersey at Monmouth University. But before that, I started my career in emergency medicine, and I always tell the story all over LinkedIn and all different social media platforms. Nursing school is quite interesting. So the faculty was not very diverse when I was in nursing school. I don't know about you, but it wasn't too diverse. So I felt like I couldn't connect well with some of the faculty. There was really one that was like super cool. She was very nice. But in my senior year, I got to pick the emergency department as my last rotation. Luckily, I got into it. So I was very excited to go there. And my clinical instructor told me, oh, what type of nurse do you want to be? And I said, I want to be an emergency nurse. And she said, Farah, you'll never be an emergency nurse. You are too unorganized and it'll never happen. And I was like shocked. I was like, what? How can an educator say this, right? So in my mind, I was like, watch me, lady. I will be an emergency nurse. And in fact, I'm going to be one of the most badass emergency nurses around. And that's what I did. I actually got hired as a nursing student in the ED. And that was back in 2005, where there weren't really residency programs. This was in Canada. And somebody made a joke who was like, I thought he was making a joke. He's like, you should apply. I put a good word in for you. I'm like, I'm still a student. He's like, go ahead and apply. So I applied and I actually got the job. And it was a trauma hospital. And I actually got 2 ED offers. There was another hospital too that offered it to me, but I really wanted this ED job, so I took it. And that's why I share this story, because there's so many nurses out there who are always told, right, the traditional, you got to go into med surge. And I'm like, no, screw that. You don't got to go there. You could go wherever you want. So that's why along my career, I decided to start this business as a nurse career coach. And I offer career services to all nurses, but the majority of the clients that come to me are nursing students and new grads, just because of that reason. I'm basically today what I needed back then, right? Giving career guidance, helping with resumes, covers, interview skills. But it's really more than that. It's a lot of like mindset work, right? Like you can do it. That imposter syndrome, especially new nurses, they think they're not enough. They think nursing school didn't prepare them. And I'm like, hey guys, listen, you guys are fabulous. You have knowledge. You can do whatever you want. You have the skills as long as you pick the right location, meaning an organization that's going to support you in your transition to practice. Or nurses that are out here with all these skills, advanced degrees, all the alphabets after their name, like me, right? I got 6 board certifications, and they're like, well, I don't know if I should like apply to this leadership position. And I'm like, yeah, you should, because they think that they have to meet all the qualifications, like every single one. And I'm like, no, like go for it. You got this. So it's a lot of empowerment. So really my mission is to empower nurses globally, not just in the United States or Canada, but empower nurses globally to really be bold, speak up, and to go after what they want in their careers and in their lives. And if that means like starting a business, a podcast like you're doing, I say go for it. And I'm all about supporting nurses. And that's really kind of been my journey. And I've held positions, like I said, in emergency medicine, 13 years, level 1 trauma center. I got doctoral scholarship from the ENA. And if you guys don't know what that is, that's the Emergency Nurses Association. And they picked me out of everybody. And this is from like, I always think about that clinical instructor that was like, you'll never be an ED nurse. So I'm like, guess what? I'm out here getting awards from the ENA. Okay. And I just became a peer reviewer for the Journal of Emergency Nursing.
Oh,
What was
awesome.
that? Exactly. Right. So I'm like, if you want something, you have to have the conviction to go for it and do it. So that's why I like to share my story. And some people might think like she's bragging. Yeah, maybe I am bragging. I don't care, because in nursing, we're taught to be modest and all this. And I'm like, you know what? You got accomplishments. You got things to show other nurses, so other nurses can feel empowered to show up and get it and get what they want, especially in interviews. Everybody's all shy and everything. I'm like, no, honey, this is the time to shine and show your accomplishments and just be out there, show up and show out. And so that's what I'm all about: positivity, bringing the energy, and a little bit about me.
That was perfect. That's exactly what I want to see, exactly what I want to hear, exactly what I want the public to hear about nursing. We have the 2 missions, the health literacy, but also promoting and elevating the platform of nursing. Because while there are more than 3 million of us, we still are very much in silos. And not only do we not know all that what it means to be a nurse, the public doesn't know either. And so we're trying to change that, and you're helping us do that. So thank you so much. So I wanted to piggyback a little bit on some things you said. So in terms of diversity during my nursing program, for my bachelor's, I went to the University of Memphis. So actually that was my first time being with a lot of Black students and also faculty. So I did have that experience, but I know your experience is actually more common, especially once you get to the doctoral level. What was your DNP project?
So interestingly enough, I picked a doctoral program strategically that didn't have statistics because I hated it. I just wanted to throw that out there. But of course, we had to do research. So we actually had to implement our project, which was like our study. I initially picked something, they didn't like it. And that's something I want to talk about. A lot of times they will try to divert what it is that you want to do because they don't like it, and they try to impress things on you. So be very, I guess, just advocate for what it is that you want to do in your doctoral program. So what ended up happening is I changed it several times, but I landed on creating a toolkit for stress reduction strategies for nurses because I'm very about creating healthy work environments and supporting nurses. And we're, really stressed in a lot of these areas that we work in. And obviously, nursing has evolved. We have a lot of expectations put on us, and not just professionally, but right, we're predominantly women in the profession. Yes, there are males coming up, but we have a lot of pressures, right? And I'm not saying men don't either, because they're like single fathers and things like that out there, but we have other responsibilities taking care of people, whether it's in a hospital or whatever we're doing in nursing. We also have to take care of ourselves and take care of our families. So it's high stress. So that's why I landed on creating that toolkit for nurses, and obviously it's evidence based. I'm very proud of it. I hopefully will publish it soon. So I'm looking for some journals, and I think I might submit to the Journal of Emergency Nursing. So that's what my project was, and I had to submit, to IRB and do the whole thing. So
wonderful. We actually recently rolled out a new series called Becoming. One of them is called Becoming a Physician with Clarence Sams. He's currently a medical student. We have Becoming Doctor of Nursing Practice with Demetrius Kirk, and Becoming a Certified Nurse Midwife, or actually just Certified Midwife. With Charity Bean. And so our audience is quite familiar with is becoming more familiar with the DNP journey and what that means. And so we just love to be able to highlight that more and just continue to increase that level of knowledge and awareness, since there seems to be a lot of questions out there amongst the public and our colleagues. So thank you for sharing that. What are all your certifications in?
So I have 3 in emergency medicine: certified emergency nurse, certified pediatric emergency nurse, and trauma certified nurse. And then the other ones, one is in leadership, so the Nurse Exec Advanced Board Certification, and then Nursing Professional Development Board Certification, which is through the ANPD, which is education. And then I have the CPXP, which is Certified Professional and Patient Experience.
For students in the public who aren't familiar with these certifications in nursing, how do you explain those?
So basically, I create a lot of content on LinkedIn. So I definitely encourage you guys to follow me on LinkedIn. So I did a post recently about certification. So really, you can get certified in any specialty, in any area. There's even pain, like a pain certification. There's so many. So basically, you should read the criteria. Most of them require at least 2 years before you can get certified. But some you don't need any of experience or hours. So you really just have to go to the specific place. So there's the American Credentialing Center, which has most of the certifications, but then there are some different pockets. Like, for example, CPXPs through the Barrel Institute. For the emergency medicine, it's through the board of, it's the BCEN for specifically for emergency medicine. And then critical care is through the AACN, which is the American Nurses of Critical Care. OB is through AWON. So it's a lot through professional organizations sometimes. I hope I could be wrong about AWON, but just check it out. So really you would just Google it, certification in, and you'll see what comes up, and then just look at the criteria. And typically for you to maintain it, you just have to do continuing education.
Wonderful. For your coaching, what services do you offer?
So for coaching, I offer a clarity call. So for those nurses that maybe are burnt out in their current area of nursing and they want to switch to something else, but they're not quite sure what the next step is, I help with a clarity call with that. Also for new nurses, maybe you're a nursing student or new grad and you're like, what? I don't know what type of nursing I really want to go into. I got you. We do a clarity call and I can help you with that. And then the other services, it's more packages. So there's really 2-tiered kind of packages, but it pretty much offers the same thing. It's clarity, really looking at your LinkedIn to optimize some of the stuff on LinkedIn, because a lot of recruiters, about 95% of recruiters go on LinkedIn to look up candidates, how to strategize and reach out to nurse managers, recruiters to get the actual interview. And then really helping with residency programs, how to build up your resume, cover letter, or even experienced nurses looking to go into leadership or education, I really tailor my sessions to like what type of questions they're going to be asking, how to show up with style. Even we go through like personal branding, all that type of stuff. And then working, I said again, on mindset, confidence. If you look at my recommendations on LinkedIn, I currently have, I think, like 52 of past clients that I worked with. And also my website, nursefarah.com. I have videos and written testimonials. There's a common thread. They all felt super confident after working with me, and really empowered. So that's kind of what I do for my clients. And if you want to check it out, just message me on LinkedIn, or you can check out my website. And I also do speak. I've been speaking for like the last 2 years now. So if you have any conferences, speaking events, I speak on different topics. Very passionate about that. And then I also wrote a book called Nurses Making Money Moves, A Nurse's Guide to Starting a Business. And that's on my website. Got to self-promote.
No, I love that. Actually, we've talked a little bit about making money moves. At least I know
Yeah.
from Rachel Rogers, right?
Mm-hmm.
And then you mentioned your publications, which I was going to ask you if you have written anything, which is great. And so when we go to your website, in terms of your speaking topic, will we be able to see the areas that you're interested in speaking about?
Yeah, there's a speaking tab that you can hit and you can see, but I really speak on different, topics. If there's something else, that an event or conference wants me to speak at, I'll definitely do that. And then I speak about entrepreneurship a lot for nurses. I spoke at the NNBA, which is the National Nurses and Business Association, last year in August in Las Vegas, and that was amazing. There was like over 200 nurses in attendance. So that's another organizations that nurses should look into, the NNBA, if they're interested in starting a business as well. They're very good with supporting. Her name is, the president is Michelle.
Thank you. And lastly, on the mindset, I like that you talked about that, because so much of the time we spend a lot of our time in academia, right, before we get into clinical practice. And there's, I don't know, an unknown myth that academia prepares us for everything, but they can't do everything, just like parents can't do everything, right? And we probably just don't tell students that enough. And so once you step outside of academia, you do need additional support, whether it's a coach, a mentor, or a community. And so just want to make sure that students and practicing clinicians are aware of that.
Right. Mentorship is huge. And I am a mentor for the Canadian Black Nurses Alliance, the ANA, and just on my own, mentoring other nurses. I think it's so important. Early on, I didn't seek out many mentors, and I should have, but that's why I kind of advocate you should have multiple mentors, even non-nurses too.
Exactly. What is your pitch for mentorship?
What do you mean exactly? Like
someone hasn't really thought about it. They hear you saying it, but they're just like, yeah, everyone tells me that.
Oh, like if they're not sure if they want to get a mentor?
Yeah, like they don't even understand the value, because I can just figure this out on my own. Look, I figured out everything on my own.
My goodness. It's you think about it almost like a coach. Like I myself as a career coach, I also have coaches. Think about LeBron James and all these elite athletes. Like why would they have coaches, right? Because you're wanting to continuously improve and elevate whatever game or industry you're in. So you're always going to be your best and always striving to be better. So that's why you should have mentors and coaches, because they just elevate yourself. And it's all about professional development. We talk about that quite a bit, but not just in your career, but even in your own personal life. Acquiring multiple skills just makes you a better person, and you're more marketable. And it just gets you to A to B much faster, trying to figure it out on your own. So you can go on YouTube University, which I love. You could read books and all these things, but like mentors and coaches will hold you accountable. They could check on you. And they're just such a vast amount of knowledge, right? Think about like when you're a kid, you think you know everything, but you don't, right? And you're talking to somebody who's like 90. Think about all the gems they can give you from their life experience, right? So that's why mentors are so important, and even non-mentors. So if you're a nurse, maybe that's interested in business, right? Yeah, get somebody who's an expert in business and nursing, but also go to some like other events. There's a lot of like business conferences and things, and get somebody who's out of that space. Or maybe you're interested in leadership. you don't just have to get a mentor who's a nurse in leadership. You can seek out some mentors that are doing other things that are not nurses.
Beautiful. Thank you so much for sharing that. I recently released an ebook on mentorship guide for nurses and nurse practitioners. I'll put that in the description box as well as all of your resources so people can contact you directly. And I love that you shouted out LinkedIn. That is my #1 social media platform recommendation for clinicians. It is a place for scholars. You can't be anonymous. You will not get bogged down watching videos that have no value. And you can make connections not only online, but in real life.
Oh, and hello, I'm going to shout myself out. I just became a LinkedIn top voice for public speaking. Yes, on Easter Monday, I found out.
Oh, congratulations.
Thank you. So yes, LinkedIn is definitely the place where I'm always, posting, and I love LinkedIn.
Wonderful. And lastly, tell us your little bit with you and Jennifer Hudson, your bestie.
Oh yeah, so like me and Jennifer, we know each other. We go way back. No, just kidding. So she basically, it was a big surprise. I applied to be on the show, and the producers kind of tricked me a little bit. And Jennifer called me FaceTime on my phone while I was home and had a conversation with me about kind of the career coaching and the nursing bit. So if you want to check it out, it's going to air on April 12th next week on Friday. So check out your local listings to see where the Jennifer Hudson show is going to be, because I'm going to be on there for a few minutes. So get my 5 minutes of fame. So check me out.
Thank you so much. Now, what is sepsis?
Yes, let's get into it. So what is sepsis? So I'm not going to get into like too much nitty gritty for those people out there, but what it is, right, is a severe infection. And it's basically the body reacts in a way where it's like a systematic inflammatory response. And the way that I would explain it to students is the way you know someone has sepsis is typically they have a suspected infection or a confirmed infection along with abnormal vital signs or abnormal labs. And that we call SIRS, which is like the early response. So it's like SIRS, SIRS stands for Systematic Inflammatory Response Syndrome, right? And it basically your abnormal vitals, you could be tachycardic, which is a fast heart rate. You could have a fever or not have a fever. You could have a low temp. You could have a low blood pressure. And respiratory rate could be elevated. And then other signs could be sweating. You can be like just fatigued, like malaise, shortness of breath, things like that. So those are some early signs, but you want to be able to capture it very early because you want to be able to prevent it, right? So the CDC has a lot of information on sepsis that for the general public is easy to understand. So I would highly suggest getting to the CDC to find out what sepsis is. And really, it can affect anybody. So you may think like, oh, no, I'm not susceptible to that. But no, it can affect anyone, everybody globally. Obviously, there's populations that are more at risk, but it can affect everybody. So really, in a nutshell, that's what it is. And it's an emergency. So you think how someone has a stroke or someone has a heart attack, sepsis should be treated the same. It is a medical emergency and it's life-threatening because if it doesn't get treated, you can die. So that's my little definition there.
Thank you. I like the language and the medical jargon, very simple. How common is it in terms of prevalence and incidence?
Right. So just to give you an idea, so it sounds kind of grim, but in the hospital, 1 in 3 people who die, 1 out of those 3 people die of sepsis. That's how prevalent it is. And in the United States, I'm going to look at my notes quickly, 1.7 million people get diagnosed just in the United States yearly of sepsis. So it's pretty prevalent. And like I said, it's very important for healthcare professionals to understand what it is and just everybody in general. And if you have a family member that's not feeling well, to really advocate for them and bring them to the emergency room, seek out medical attention. because you don't want to miss it. Because when it starts, it really escalates really quickly. And what you need to do, obviously, if you have an infection, there could be different reasons why you have that infection. So you could have a viral infection, which is caused by a virus, a bacterial infection, which is most commonly why people go into sepsis from bacteria. And obviously, you need antibiotics right away. And then you can have other infections like fungal or whatever, parasites. But the majority of the time, it's due to a bacterial infection. So you need to seek out medical attention really fast. And you need to get antibiotics as soon as possible. And the recommendation is within 1 hour is really how fast you need to get it from diagnosis.
And what are the risk factors?
So risk factors, obviously, like I said, people that are susceptible are really young infants or babies. And if you think about it, most babies don't typically get fevers. So when I used to work in the emergency room, if any infant came in that was a month or less and had a fever, it's like, oh my goodness, sepsis alert. So really, if you're working in a hospital and you have Epic or different MRSAM systems, you'll get an alert that you could have a sepsis alert. So those poor infants, we'd have to do a whole, basically pan culture them, which means check everything to make sure that we could see where the source is coming from of the infection. And one of those things we had to do a spinal tap. So they had to actually get fluid from their spine to make sure that it wasn't meningitis. So it's very sad to do infants, but it's life-threatening. So obviously infants and young children, because their immune system is not really built up yet. Really old, right? Really elderly patients are more susceptible. And obviously anybody who's immunocompromised, which means, maybe having HIV or cancer, you cannot fight infections as well. Or maybe if you're on steroids, transplant patients, things like that. And if you already have chronic illnesses such as asthma, PD, diabetes, things like that, you're going to be more susceptible to getting sepsis or, cardiac issues, things like that.
Yeah, I love that you brought up the pan culture because, patients always want to know why we're taking so much all the time, right? And so typically that means we're going to look and see if it's an identified infection, like you mentioned, or maybe you're just at risk for it. So maybe you have a foreign object like a catheter, a central line, a Foley. We're going to start there because those are the most common infections that people get. Might get a sample of that urine, might get a sample of your blood, might get a whole panel of blood work looking at your kidney function, liver function, risk for anemia, an infection. If there's concern that if maybe you have a trach, maybe you might have a pneumonia. So those are we start with the most common things, try to rule those out. And then if those aren't there, then we dig a little more deeper. And we might be digging more frequently than you like until we get the answers that we need, or we get you more stable.
Right. And I wanted to mention something really important as well. This is both for the public and any healthcare professional. It's very tricky to diagnose sepsis in post-op patients, meaning patients that have just had surgery. It's very difficult because a lot of the symptoms that are happening post-surgery can mimic sepsis. So for example, if you just had a knee surgery or hip surgery or whatever, your white blood cells will be elevated because trauma can cause elevated blood cells, right? You will probably be a bit tachycardic because you have pain, right? Or just, you have some inflammation and your body's trying to recover. So those signs can mimic sepsis. So that's why if you have a surgical site, you have to really look at, is it, how red is it? Does it look odd? Is there something smelly that's like coming out of it, the odor? If something doesn't look right or seem right, you need to get to call your doctor and get to the room, because sometimes even orthopedic physicians or surgeons, they're like, oh yeah, that's like, that person's post-op, that's normal. But it's like, as a nurse, if you know something is not right, you need to escalate and advocate for that patient, because it's very tricky to find if they have sepsis post-op, especially even after having a baby, right? There's a lot of maternal child issues A lot of women dying for, that's like a whole nother show, but they can have sepsis, right? So
Yeah, I love that you brought that up, because so much of the time, for one thing, if you're a new clinician, trust your instincts. That's why you have them, right? And when in doubt, ask your senior colleagues. At least bring it up and find out that you're wrong, as opposed to not saying anything and find out that you're too late.
right, or just call a rapid response if you're in the hospital. They love that.
And that's when that emergency team who's standby comes
Right.
to the bedside to really kind of take care of that patient one-on-one, so that the staff can continue to take care of the other patients.
Right.
And each hospital,
in some instances, family members can also call a rapid response. Like if you feel that they're not listening to you, the staff, and your loved one does not look right, sometimes there are numbers that says, "Oh, call a rapid response." You can also do that and advocate for your loved one. So I just wanted to, throw that out there.
please use it for the indications that are listed, and not for things like crackers.
Right. Sorry, I don't want everybody calling responses everywhere.
And I think it's important that we let the public know that we look at, because you mentioned how complicated it can be in those particular patient groups, that we're looking at a whole picture, because a lot of times, you just listed like 5 or 10 things, and the patient or their family might focus on like the smell or this one symptom or one sign. And yes, it is an important indicator, but we look at you as a whole patient. We need a whole bunch of data to do the diagnosis.
Right.
Especially when we're talking about antibiotics, and that's another show.
Yes.
And so, what's the treatment? You kind of went into that, and then who's going to be on that care team?
Yes. The treatment is going to be, like we talked about, antibiotics, but not just that. Also, you got to think there's no real clinical. Really, you're looking at clinical symptoms to diagnose sepsis. There's no real test that's going to tell you, yes, ding, 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 sepsis, right? A lactate, you could do lactate, and it could be reflective of potentially sepsis, but there's other reasons why your lactate could be elevated. So, for example, if you have a seizure, your body's not getting the oxygen it needs, your lactate's going to be up. But the lactate is a very good indicator, and we trend that. So meaning we look at that over several periods of time, because if we see your lactate going up, that's a bad sign that could be indicative of sepsis. However, there's no real one that's going to tell you have sepsis. And that's why, like you were talking about, Dr. Madison, you got to look at the whole picture and look at the patient as a whole and look at everything. So yes, we need to give antibiotics right away. We also need to give fluids. So according to the CDC, typically we give 30 cc's per kilo. So 30 mils per kilo. So if you have a patient that's 100 kilos, most likely you're going to be giving 3,000 mils, which is 3 liters of fluid. So you just got to think about it. When you have a fever, you feel horrible, you're probably dehydrated. So we need to give you a lot of fluid at once. So fluid is another thing. And if it's not working and your blood pressure is still low, that means that you could probably be entering another stage of sepsis. There's different stages. So there's sepsis, severe sepsis, and then you can get into septic shock, which is a shock state that's very bad, because then you become tachycardic, which high heart rate and low blood pressure. It means your heart is not really able to give your body what it needs, because blood carries oxygen, right? And if you're in a shock state, that means it's no good. Like you're entering bad territory. So that means your body is not perfusing well, meaning not getting the oxygen and blood that it needs. And then that can cause something else called MODS, which is multi-organ system failure. You don't want to be there, right? Because at that point, you should be in the ICU, the intensive care unit, because at that point, or in the emergency room, we're going to try to get you quickly there to a higher level of care, because now you may have to be put on vasopressors, which is basically, think about, if you're putting a bunch of fluid in a balloon, right, you need to squeeze it for it to come out. So it's kind of like you got to give a lot of fluid, but if your body is vasodilating, which is what happens during sepsis, you need to constrict it so you can give your body more perfusion, if it makes sense. So your cardiac output is a little better and you can perfuse better. So typically you're on, probably norepi, like epinephrine, norepinephrine, to help you a little deep, but you're going to be, really sick with a lot of lines and hopefully not altered mental status, because you could maybe have to get intubated if it's that bad. So really the treatment, we don't want it to get to that point, but we want to treat early, because early recognition and early treatment is really where it's at. And like you mentioned, you're going to have on the team, you're going to have support workers such as PCTs, nurses, aides, physicians. It could be the emergency physician or the intensivist. You might have infection disease that comes in and maybe consults. If you have other chronic issues, they may have to consult other people. You may have to be going to CAT scan where the radiology team is there doing different things. So you're going to be seeing a lot of people on the team to help you, maybe social work for the family, things like that.
Yeah, so just going to back up a little bit. So you mentioned lactate. That's a blood draw, right? And it's going to be more than one. And while the goal is to stick you one time, oftentimes if you're in this position, your blood vessels might not be the most friendliest. And so you might get a few more sticks than any of us want. We all want to have that stick. It just doesn't always happen. And fluid is a big part of that, right? If those vessels aren't nice and juicy, we're now on a search hunt, right?
Right.
And so fluid's a big part of this. And so typically that infection is local, like one location. And what we're trying to do is prevent it from spreading, because once it gets in your blood system and spreads, that's so much harder to control, right? And you mentioned tachycardia, which is an elevated heart rate. So your heart is designed to have enough time to fill up completely and then release as much blood as possible to the rest of your system, including those organs, what we call vital organs, the brain, the heart, the lungs, the kidney, the liver. When it's moving really fast, pumping really fast, it can't fill up adequately. So then it can't release the amount that you need. And then those organs aren't able to perform at the level that they need. Over the course of time, which can be really a few hours, we start to see those complications that she's going over. So hopefully that makes a little bit more sense why this has become such an emergency. And then those pressors, which have their own complications, right? So now they're like high blood pressure medicine on steroids. And when you're constricting blood flow, that means like your little bitty toes that are so far away from your heart might not get the blood, because now it's already gone through all your major organs. And so on the other side of that, now we have wounds or gangrene, or where your toes are turning different colors. And a lot of times the complication with that is loss of limb, amputations, loss of function, nerve, and pain that can last really the rest of your life.
Right. And that's an awesome explanation. I wanted to also touch upon something. Common infections that tend to get out of control and become sepsis is truly usually lungs. So you might have a pneumonia, something like that goes out of control and now you be septic, or any GI issues or abdominal issues, right? So sometimes, like for example, if someone has appendicitis, you think, okay, it's like, you just got to get your appendix out. But let's say they can't get to the OR in time and now this appendix burst. If you have severe pain and you have appendicitis and all of a sudden you have no pain, it went away, that's a problem. Especially if you're a nurse, you got to get that patient to the OR right away, because now your appendix has burst and there's all this stuff going in your abdomen, which is called peritonitis. And that can cause severe abdominal infection that can lead to sepsis and potentially death, like we talked about. And then other things like urinary tract infections. You may think, it's just a urinary tract infection, but we know, especially in the elderly or people that have catheters, right? Like urinary tract, Foley catheters, or even other catheters, right? Like permacaths, like for dialysis patients, like you mentioned before, or say a PICC line, those can become infected and cause big issues. So that's why if you were a nurse and your patient has a central line and they don't need it anymore, you got to advocate to get it out.
Ooh, that's such a good point. And you mentioned the PICC line, which is that catheter in the arm, also that Metaport. Man, those
Yeah,
they do a lot of good. They really do. But
right,
they do have their everything has effect
right.
and complication.
Why you have to really, if you have something like that, you have to try your best to keep it clean if you're at home and really listen. If you're not sure how to take care of it, please reach out to the medical team to make sure they teach you how to do it. And that's why nurses and physicians out there and medical professionals, please do really good education upon discharge or even upon admission so people know how to treat and take care of themselves so they don't have to come back, right, for readmission into the hospital. As a former educator, I've seen some discharge information. I'm like, can you please break it down a little more? Because I don't think they understand. Like, teach back method, have the patient teach back to you so they know. And you got to think, there's so much going on. They may not be listening. They got a bad diagnosis. They're not really focused. So please, multiple reinforcement for education for patients.
Excellent example. And I think it's important for the public because nursing, we really try to do our best to stay on top of keeping things clean. But particularly when we're talking about like the groin area, a lot of times that's a bit of a bit of a challenge to get patients to participate in keeping those areas clean. It's a
Right.
private area. These people are typically home independent, taking care of themselves, and they don't
Right.
understand why you need to go down there all the time and check on things. And hopefully through this episode, we're helping to bring awareness to why it's so important to keep that area clean. It's warm, it's moist, bacteria loves to hide there, and
Right.
just need to keep an eye on it, keep it clean, and make sure we avoid what we were talking about today, which is sepsis.
Right. And another area last that I wanted to mention is the skin,
Oh,
right? Right. So like people that have diabetes or any open area on your skin, right, can be a source of bacteria or whatever getting in, and it could cause an infection, a skin infection. A lot of times we cellulitis. So if you have warm red skin, or sometimes in the ER, cats would scratch people, right? So cat scratch, horrible. Or any bites. Sometimes there'd be dog bites or different things like that. Animal,
tigers.
it can quickly become very infected. So don't just think, oh yeah, it'll heal on its own. Please go get it checked out. And if it starts to grow, right, like you got to go probably get into IV antibiotics. Skin is another big one.
Yeah, when we catch things early, it can be as simple as a pill. But when
Mhm.
it gets advanced and you need something IV, then you have to get admitted. And that's a bigger bill. That's time off from work. It's more stress. That's sharing a room with someone you don't know, not sleeping at night, getting blood sticks in the middle of the night. That's what we're trying to help you avoid. All the things you're complaining about, we know. That's what we're doing this show to try to, it's preventable. We don't all want to shoot you up with pills and all these other things. We're trying to help you prevent that. I love it that you brought up the skin. It's the largest organ of the body. It's often neglected, particularly as people get older, that belly gets bigger, they have difficulty breathing, they can't bend over and touch their toes or their feet. And so the skin gets neglected. And when it's dry and cracked, it opens up,
I
right?
was
And
just gonna start singing a song.
oh, yeah. What's the song? Now I'm
You
curious.
know, bend over and touch your toes. Don't mind me.
Yeah, and people don't want to ask for help. And
Yes, 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 yes.
it's really all this stuff is so
Oh, the
preventable.
bottom of the foot. The bottom of the foot.
Diabetics, right? You
Yeah.
have to look at those feet. You have to look at them every day, even if you can't use a mirror or your phone, because the smallest crack leads to wounds and open areas. So you had, oh, another, I know I wanted to give, Alicia loves to talk about smoking cessation. And so I want to make sure. So we always talk about smoking when it comes to lung cancer, but a lot of people don't get lung cancer, right? They're not going to get lung cancer. They will COPD, they will have really bad asthma, but you know what else they're going to get? They're going to get vascular disease. So whether that's venous disease or arterial, and a lot of people really don't know about these things till it happens, and that can affect their circulation in their legs and their feet. Those tend to lead to wounds, and those wounds are what we call chronic and prolonged healing, right? They can have the wounds for years, decades, and that openness puts them at risk for infections and back and forth to the hospital.
Right, right.
And that's depressing, right? And that brings in that mental health component. And while we have great treatments, they don't cure. They
Yeah, you
just
want to be preventative and really, health promotion, which I feel like Canada sometimes does a little bit better with health promotions and screenings because, there's more access to care there. Spend a little bit more money on it. So I think, like you said, just make sure that you're really being proactive and trying to prevent these things.
Wonderful. How can people connect with you?
So on LinkedIn, I'm all over LinkedIn. You could literally just message me on LinkedIn. You could follow me. You can go to my website at nursefarah.com, and it's one R, nursefarah.com. That's my website. Or you can email me. My email is also on LinkedIn. I'm also on Instagram and Facebook, but I'm not really that active on those platforms. You can find me on YouTube as well. I have my own show called The Nursing Dose with Farah, and I have a lot of shows kind of like this. And then I also take that the audio, and I've now reestablished my podcast, which is called The Nursing Dose with Farah, which you should come on the show.
Wonderful. Yeah. Consider invitation accepted. What do you talk about over there?
Oh, I talk about various things. So sometimes I do it on my own, talking about different topics in healthcare or business, entrepreneurship. I also have nursing guests that come on, like different leaders that come on, and also non-nurses that come on, talk about business or wellness, different things. Or you could come and, talk about anything that is near and dear to you. And then it's usually something related to the audience that like what they would like. So we talk about all different things.
I have a referral for you. Should be the next president of the American Academy of Physician Associates.
Oh yeah, definitely. Yeah.
She's currently the president of PAs for Latino Health. So I think you two would have actually. I think this is a great opportunity to.
Yes, because I'm also about amplifying, other nurses and their voice and things like that. So.
Wonderful. Okay, so remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Please share the show with your friends and rate the Apple Podcast and Spotify. Leave a comment. Really helps the show get more support and gets the message to those who really need to hear it. You can find all of our links, social media resources related to sepsis in the description box today. We release a show weekly. I think we're going to be switching our weeklies from Tuesdays to Sundays. So just stay tuned for that. Still deciding. But we can't thank you enough, Dr. Farah Laurent, for your time, for your expertise, and for sharing your nursing journey. We know not only are you helping to improve health literacy amongst the public, but you're helping to inspire that next and current generation of nurses who have what it takes to go to the next level and just need to know what it really means to be a nurse.
Thank you so much. I appreciate the opportunity. It was a lot of fun. Thank you so much.
Thank you for watching.